So someone wanted to know something about Good syndrome, which is not good, by the way. So Good syndrome is associated B and T cell immunodeficiency. And when you have both problems on the B cell side and the T cell side, that combined immunodeficiency is going to be a problem for immunity that relies on these cell types. And the thing that it's associated with is thymoma. So now you can see how this is going to present to neuro-ophthalmology. So the thymoma-related things are usually myasthenia gravis, because that is a T cell mediated process and has B cell production of anti-acetylcholine receptor antibodies, binding, blocking, and modulating. And so patients who have myasthenia need to have a CAT scan of their chest for thymoma. But if in their chart they've had multiple recurrent infections, you should be thinking about the Good syndrome in that patient. However, the thymoma is also associated with paraneoplastic disease, and the antibody that's associated with that is glutamic acid decarboxylase, GAD, which is involved in the conversion of glutamate to the inhibitory neurotransmitter GABA. And so that GAD is associated with neuro-ophthalmic things: ophthalmoplegia, diplopia, nystagmus, usually downbeat, cerebellar ataxia and cerebellar forms of nystagmus, and a very strange form of diabetes called LADA. So we can get stiff person syndrome, cerebellar ataxia, downbeat nystagmus, and latent autoimmune diabetes of adulthood, LADA. So these are the GAD antibodies. And if you have antibodies in one thing, you might get antibodies to another thing. And so those are the thyroid antibodies like TPO and TSIG. So all of this is derived from dysregulation in the immune system. For antibodies, that's B cell, and for cell mediated, that's T cell. Because these patients with the Good syndrome have both, and they have the thymoma, you need to know a little bit about Good syndrome.